If we look at the bottom of the left kidney,
The left kidney, okay?
what's going on there?
Well, this is interesting because when I see this image, I notice this lump, this indentation here, this dark linear line. I don't think that's anything. I think it's just part of the normal kidney, although it may have the appearance of something sort of coming off of like a nodule, but it's really not. That looks to me like a possible scar, like a previous scar tissue, previous infection. That looks like a linear scar to me. It has no clinical concern.
And that's the question I have. That linear scar there, the kidney is not round and perfectly shaped, is it?
No, kidneys are, very often can have a smooth contour, and they can, but very often they'll have lumps and bumps. I think even the picture that you showed up there showed a little lump at the top of the kidney. It wasn't a perfectly round cylinder.
Does that scar there mean you have to get a contrast CT scan to follow up on this study?
No, it does not.
Okay. Let's talk about the right kidney briefly.
Okay.
I think the jury's heard multiple times. Is there a cyst in the right kidney as well?
Yeah, I believe that's a cyst right there.
Have you had a chance to go through the images of the right kidney cyst?
I have.
Is that kidney cyst perfectly spherically shaped like a golf ball?
Well, certainly on these images, it's not. As if you scroll down, you'll see it starts over here, and then it's over here, and it comes and it moves. It moves tangentially this way, suggesting more possibly an ovoid appearance, or maybe even a cylindrical appearance, because it starts here and ends over here, as opposed to this. This cyst here sort of starts and sort of stays in the same plane the entire time.
Does that ovoid or cylindrical appearance mean that that cyst needs a follow-up contrast CT scan?
It does not.
If we look at this bottom area of the cyst here, tell the jury what you're seeing happening there. The right cyst. I mean, right kidney, sorry.
On the right kidney. Well, it's here, and it's coming out the edge. I lose it there.
All right. Is this...
Oh, this.
Right.
No, that's just part of the normal kidney. See how it kind of comes up? That's a contour issue. Thank you. That's actually a contour issue here. You see it kind of goes and then that's a normal variant.
Is that a suspected nodule?
No, it's not.
Is that a finding that requires a follow-up contrast CT scan?
It doesn't.
Okay. Let's talk about the cyst that we have been talking about for the rest of this trial. Tell the jury what you see on this upper pole cysts on the left kidney.
I've seen these images so many times now.
And
I see them in my sleep. Here's a cyst here, and based on my read earlier, I think there might be another cyst here.
Is that a concerning finding to you?
In my opinion, it is not.
For you as the urologist stepping into the radiological realm, do you see something that needs a follow-up contrast CT scan for assessment?
If I were viewing this CT scan in my office in a patient who presented with a kidney stone in a clear clinical situation, I would not pursue anything different with that at all.
Okay. Now, would you use the word lobulation to describe that necessarily?
I would not. It looks to me like it's a rounded structure coming off.
Well, you do see, and we'll get to the report, it is described as a lobulation in the report, correct?
It is.
And I think Dr. Hill might agree that it's a lobulation. Does the use of that word mean, all right, now, it's not a simple cyst, you need follow-up imaging?
Lobulation in and of itself does not represent anything to me that I would see as concerning in and of itself. Lobulations occur in all parts of the body, as I mentioned, my earlobe. The things that would concern me in terms of looking at whether this is a simple cyst or a complex cyst are the things we talked about earlier. Septations, calcifications, thickening of walls, other things that are going to bump this up that in my experience, with my training, are going to be more complicated.
Two things I want to be perfectly clear on. The description of a lobulation, does that mean that it's not a simple cyst? Just the word lobulation?
No, it does not.
Just two cysts together on the outside of the kidney, does that mean it's not a simple cyst?
I've seen simple cysts look like this intraoperatively and in numerous scans.
All right. Thank you. You can take a seat.